Hi, my name is Celine Bonilla, and I'm an APRN student attending Purdue University to be a family nurse practitioner. Today we're here for an annual wellness visit. Before we begin, do I have your verbal consent to record this interview for student assignment purposes?
Yes, I consent.
Thank you. So I reviewed your chart, and it looks like you have a history of hypertension, hypothyroidism, and you had a colonectomy in 2019. Is all of that information still accurate?
Yes, that's correct.
And you're taking hydrochlorothiazide 50 milligrams and Synthroid 0.75 milligrams daily. Is that correct?
That's correct.
Okay. And do you have any questions concerning those medications?
No, not at all.
Okay. Do you have any medication allergies?
No allergies. No.
Okay. And on your chart, it looked like you have a chief complaint of headache. When did your headache start?
About a week ago.
And where is the pain located?
Mainly in my temple and both of my sides.
And how long do they usually last for?
About 3 to 4 hours.
And can you describe the pain?
Throbbing kind of pain, almost like a pulsing.
I'm sorry you're experiencing that.
Okay.
What makes it worse?
I've been thinking that I think maybe the stress, my job stress, related stress, and also the fact that I'm not sleeping. Yeah.
Okay. I'm sorry to hear that.
Thank you.
What makes it better? Does anything make it better? Any medication or?
Well, I've been taking ibuprofen.
Okay. When do your headaches typically occur?
I'd say late afternoons.
Okay.
Yeah.
And in terms of pain, on a scale from 1 to 10, 1 being the least, 10 being the most, how would you rate your pain?
I'd say about a 6, maybe. About a 6.
Okay. Are you having any vision changes, nausea, light sensitivity, or any neck stiffness?
No, not at all.
Okay. So we're going to go into preventative care and social history. It looks like you had a pap smear last year. Did everything come out normal?
Yes, everything came out normal. Mm-hmm.
Okay. And do you have a mammogram scheduled for next month?
I do actually, yes.
Okay. And in terms of a colonoscopy, do you have a colonoscopy scheduled?
Well, I'm hoping to schedule it when I turn 50, which is going to be, soon, but I'll definitely be scheduling it. Okay. Not looking forward to it, but I'm definitely going to schedule it.
Do you have any questions or concerns or any resources?
No, not at all.
Okay. Did you get your flu shot for this season?
I did, yes.
Great. And are you still working in retail?
I sure am.
Is that the cause of your afternoon headaches? Is that a trigger?
I think so. I mean, I've been a little bit stressed out, and I know it's been very much job related.
Okay.
Yeah.
Are you still married?
Yes.
Okay. And do you have 2 teens, right, in high school?
Oh, yes, I do.
Are you using any tobacco, any illicit drugs?
No, not at all.
And in terms of alcohol, are you consuming alcohol? How much per week?
I'd say about 1 to 3 glasses of wine a week.
Okay. In terms of exercise, are you doing any exercise and how many times per week?
I've been kind of walking and just started introducing a little yoga, about 3 to 4 times a week.
Okay. Yeah. So now we're going to go into a little review of just your body, head to toe systems. It's normal for a visit. Are you experiencing any fatigue, fever, chills, any weight changes?
No, not at all.
Okay. And are you experiencing any rashes, any dryness of your skin, any itchiness?
No.
Okay. And I know we discussed your headaches, but are you having any sinus pressure, sore throat, any hearing loss?
No.
And for your neck, are you having any swelling or stiffness on your neck?
No.
Okay, great. In terms of your breasts, have you noticed any lumps or any tenderness?
No, not at all.
Okay. Have you experienced any wheezing or coughing or any shortness of breath?
No.
Okay, great. It's all great stuff.
No.
In terms of your heart health, have you been having any chest pain, any heart palpitations or swelling?
No.
Any leg pain, any leg cramping, varicose veins?
No.
Great. In terms of your abdominal, are you having any nausea, vomiting, constipation, diarrhea, any abdominal pain?
No, not at all. Mm-mm.
In terms of urination, are you having frequency, urgency, burning, or any incontinence?
No.
Great. In terms of your menstrual cycle, has it continued to be regular?
Oh, yes. Mm-hmm.
Good. Any abnormal bleeding or discharge?
No, not at all.
Any questions or concerns?
No.
Okay. In terms of joint pain, are you having any joint pain, stiffness, swelling?
No, just normal. I guess my age, you start getting some of those little pains and aches.
Completely understandable.
Yeah. Mm-hmm.
I know you do have the headaches, but have you had any dizziness, numbness, weakness?
No.
Okay, great. What about any bruising or bleeding? Have you noticed any of those signs?
No.
Okay, great. Have you noticed any heat or cold intolerances?
No, not at all. Mm-mm.
Okay, and any increased thirst or urination?
No.
In terms of just normal mood, have you been feeling more depression, anxiety, or any sleep disturbances? Any of those?
No, mainly, my sleep, having difficulty sleeping sometimes when I get really stressed out, but other than that, no. My mood's been pretty good.
Okay. Do you think there's anything that can help reduce your stress on a day-to-day basis?
I don't know, there's a lot of transition going on in my job right now with the reorganization in the company, so
Completely understandable.
I'm hoping that, there's a better outcome for that. So hopefully, right now we're all being overworked, but I'm hoping for better days.
I'm sorry to hear that.
Yeah.
I hope things progressively get better and easier for you.
Thank you. Thank you.
Do you have any questions or any concerns at all?
No, not at all.
Okay. Well, thank you, Anita. All this information really does give me a full picture of your health. We'll continue to monitor your blood pressure and your thyroid. We'll follow up on your screenings, and we'll look into your headaches more, especially if they persist. And if anything else changes, please do not hesitate to reach out. Lastly, I want to make sure that you know that this is a safe and inclusive environment. So if you have any cultural, personal, religious, or any other preference related to your care, please let me know so we can accommodate. Your comfort and your identity are always extremely respected here.
Thank you. Thank you very much.
Of course. And if you have any other questions, please feel free to reach out.
Okay, I will. Thank you.
No problem.